Welcome to our educational video on Bartter syndrome, a rare inherited kidney disorder. Join us as we explore the intricacies of this condition, from its causes to its management, providing a comprehensive overview for those seeking to understand Bartter syndrome better. Bartter syndrome is primarily caused by genetic mutations affecting specific proteins vital for salt reabsorption in the kidneys. These proteins are located in the loop of Henle, a critical part of the kidney responsible for concentrating urine. Different genetic mutations can lead to various subtypes of Bartter syndrome, each with its own specific characteristics. Inheritance is autosomal recessive, meaning that an individual must inherit 2 copies of the defective gene, one from each parent, to develop the syndrome. While the condition itself is genetic, spontaneous mutations can occur, leading to new cases within families without a prior history. The fundamental problem in Bartter syndrome lies in the kidney's inability to properly reabsorb sodium chloride and potassium in the thick ascending limb of the loop of Henle. This dysfunction leads to excessive salt and water loss in the urine, resulting in a constellation of problems. The body attempts to compensate for this loss by activating the renin-angiotensin-aldosterone system, leading to elevated levels of these hormones. This hormonal imbalance contributes to potassium loss, metabolic alkalosis, a condition where the blood becomes too alkaline, and increased prostaglandin production. Prostaglandins further exacerbate potassium loss and contribute to the symptoms experienced by individuals with Bartter syndrome. Bartter syndrome is a rare disorder, with estimates suggesting it affects approximately 1 in 1,000,000 individuals. Due to its rarity, precise epidemiological data is limited. It's found worldwide, affecting individuals of all ethnic backgrounds. However, certain populations may have a slightly higher prevalence due to founder effects, where a specific genetic mutation is more common within a particular group. The signs and symptoms of Bartter syndrome can vary in severity and age of onset. Common symptoms include excessive thirst, frequent urination, particularly at night, and a craving for salt. Children with Bartter syndrome may experience growth retardation, delayed development, and muscle weakness. In some cases, kidney stones and nephrocalcinosis, the deposition of calcium in the kidneys, can occur. Electrolyte imbalances, such as low potassium levels, can cause fatigue, muscle cramps, and even cardiac arrhythmias. Some individuals may also experience constipation or abdominal pain. Diagnosis of Bartter syndrome typically involves a combination of clinical evaluation, laboratory testing, and genetic analysis. Blood tests will reveal low potassium levels, metabolic alkalosis, and elevated renin and aldosterone levels. Urine tests will show high levels of sodium, chloride, and potassium excretion. A urine chloride test that doesn't decrease with decreasing sodium intake is suggestive of Bartter syndrome. Genetic testing can confirm the diagnosis by identifying the specific genetic mutation responsible for the condition. Imaging studies, such as ultrasound or X-rays, may be used to assess the presence of kidney stones or nephrocalcinosis. Bartter syndrome is classified into several types, each associated with mutations in different genes involved in salt transport in the loop of Henle. These include Type 1 neonatal Bartter syndrome, caused by mutations in this LC2A1 gene, encoding the NKCC2 protein. Type 2 antenatal Bartter syndrome, caused by mutations in the ROMK gene, also known as KCNJ1. Type 3 classic Bartter syndrome, caused by mutations in the CLCK and CSNKB genes encoding chloride channels. Type 4 Bartter syndrome with sensorineural deafness, caused by mutations in the BSND gene, encoding Barton, a chloride channel subunit. Type 5 and hypercalcemia and nephrocalcinosis, caused by mutations in the CASR gene, encoding the calcium-sensing receptor. Each subtype has slightly different clinical features and severity. The primary goal of treatment is to manage the electrolyte imbalances and associated symptoms. Potassium supplementation is crucial to correct hypokalemia. Medications, such as nonsteroidal anti-inflammatory drugs and NSAIDs like indomethacin or ibuprofen, can help reduce prostaglandin production and improve kidney function. Potassium-sparing diuretics such as spironolactone or amiloride can also be used to minimize potassium loss. In some cases, magnesium supplementation may be necessary. A high-salt diet is often recommended to compensate for the excessive salt loss. Regular monitoring of electrolyte levels and kidney function is essential to adjust treatment as needed. For individuals with severe nephrocalcinosis or kidney stones, additional interventions may be required. Because Bartter syndrome is a genetic disorder, there is no direct way to prevent it. Genetic counseling is recommended for families with a history of the condition who are planning to have children. Genetic testing can identify individuals who are carriers of the defective gene, allowing them to make informed decisions about family planning. Early diagnosis and management are crucial to minimizing the long-term complications of Bartter syndrome. but do not prevent the presence of the condition. The prognosis for individuals with Bartter syndrome varies depending on the severity of the condition and the effectiveness of treatment. With proper management, many individuals can lead relatively normal lives. However, long-term complications such as chronic kidney disease, nephrocalcinosis, and growth retardation can occur. Ongoing research is focused on developing new therapies to target the underlying genetic defects and improve kidney function. Gene therapy and other innovative approaches hold promise for the future treatment of Bartter syndrome. Researchers are also investigating the role of specific prostaglandins in the pathogenesis of the disease and exploring potential therapeutic targets to modulate their effects.